Good afternoon and welcome to today's community briefing on our fight against COVID-19. Here once again to provide interpretation is Margie Prop. And thanks so much, Margie, for being here. And thank you to you for joining us to learn more about the latest local developments in our efforts to end the pandemic. We are making amazing progress in Lincoln in our fight against this virus, and that progress is saving lives. We see this progress reflected in the data we track and evaluate. And as Health Director Pat Lopez will share shortly, the data and metrics used for our COVID-19 risk dial have continued to improve. Much of this improvement has been made possible thanks to our community's great progress with vaccinations. Over 67% of Lincoln and Lancaster County residents aged 16 and older have received at least one dose, and nearly 55% are now fully vaccinated. And from the very beginning of this pandemic, our priorities have been to protect the public's health, to slow the spread, to prevent our hospitals from becoming overburdened, all of which have the ultimate goal of saving lives. And locally, we've been able to act on these priorities with the measures put into place and with the great commitment of our residents. Because of our collective action, Lancaster County's COVID-19 case rate as of today is about 82 cases per 1,000 population. Thank you for helping us to maintain the lowest case rate among the 5 most populous counties in our state. And thank you as well for helping Lancaster County to continue to have the second lowest fatality rate of the 5 most populous counties in our state at 7.5 deaths per 1,000 cases. By comparison, the state's fatality rate overall is 10.2 deaths per 1,000 cases. I want to show you a chart now. This is a visual that helps illustrate how our actions here in Lancaster County are making a difference. The chart shows a decrease in local COVID-19 deaths and how that correlates with our community's progress with vaccinations. As you can see, the yellow line represents the ever-increasing number of vaccinated residents since December, and the blue line shows a decreasing number of deaths during the same period. Unfortunately, we have no reported deaths so far this month. Now, these might just be 2 simple lines, but they say so much. They represent a year's worth of work by all of us that has moved us closer to ending the pandemic, loosening the directed health measures, and finally putting one of the most difficult years behind us. And here now to share more about our forward progress together is Health Department Director Pat Lopez.
Thank you, Mayor. It's clear our collective efforts are moving the community in the right direction. As the Mayor mentioned, we've seen much of our local data improve and level off over many weeks. However, in the past few weeks, we've seen more significant improvements in most of our key metrics. This chart shows the progress with vaccinations depicted by the yellow line and the decreasing number of COVID-19 cases per week represented by the blue line. We know that having more people vaccinated is reducing opportunities for transmission of the virus. This past week, we had about 184 cases, the lowest count since the week ending August 22nd, 2020. Also, if you look at the weekly positivity rate, we can see this same correlation with vaccinations going up, shown by the yellow line, and the positivity rate going down more significantly over the past few weeks, which is the blue line. As we know, the higher the level of immunity in the community, the larger the benefit. This is why it's so important to get as many people vaccinated as possible. Measles, mumps, polio, and chickenpox are examples of infectious diseases that were once very common but are now rare in the United States because of our high level of vaccination established that high level of protection. Vaccination is the most important tool to help end this pandemic. It benefits people in every age group by providing protection against the virus and preventing illness. At our clinics, we've seen people from 16 years old to almost 100 years old roll up their sleeves and get vaccinated. Actually, we had somebody who came in that turned 100. We also understand that some people may have questions about the vaccine, including people who are interested in starting a family or those who are pregnant or breastfeeding. We're pleased to have Dr. Sarah Chadha here with us today. She's a Lincoln physician with gynecology and fertility PC and specializes in obstetrics. She'll talk more about the COVID-19 vaccine, what she's hearing from her patients, and the information she's sharing with them.
Hello, so I'm Sarah Chadha. Nice to meet you. I am a member of the Lancaster County Medical Society, and I'm an OB practicing here in Lincoln. I am also a member of the American College of OB-GYNs, and that group has put out national guidelines regarding vaccinations, including the COVID vaccine and pregnancy. The American College of OB-GYN, also known as ACOG, recommend that pregnant women have access to the COVID-19 vaccines. While safety data is limited about the vaccine use in pregnancy, all the information we've gathered so far show that it is safe and there haven't been any adverse risks increased in pregnant women compared to other populations. When my patients come in and ask about the vaccine, I tell them that I think it's like many things in life, we have to take the risk versus the benefit. So what's the risk of COVID in pregnancy? The risks seem to be similar to what it is in other populations, although there are a couple of things that I think are more important in the pregnant population. One is the high fevers that you can get with COVID vaccine or with the COVID virus. I've heard of patients getting fevers as high as 106 degrees. High temperatures in pregnancy can cause damage to the fetal nervous system and brain development. Nobody wants that for their baby. The other concern with the COVID virus infection in pregnancy is if pregnant women get pneumonia, especially in the third trimester when somebody's baby is taking up most of their abdominal cavity and pushing their abdominal organs up into where their lungs are, they often get short of breath. In women that get pneumonia in the third trimester, it can be very difficult to oxygenate them and to get enough oxygen to the baby. So the risks of the COVID vaccine appear to be low. It appears to be safe for general populations. The safety of the vaccine for pregnant women, they weren't initially included in the trials, the initial vaccine trials, but data is being collected by the CDC. If pregnant women get the vaccine, they're encouraging them to enroll in the VSafe program where we're collecting data currently. The early data from the CDC VSafe program pregnancy registry hasn't indicated any safety concerns in pregnant women. Self-reported information on COVID vaccine safety hasn't identified any specific safety issues in pregnant women. The phase 2 and phase 3 clinical trials of the vaccines indicate that the safety and efficacy in pregnant and non-pregnant women is similar. There are some unfounded claims linking the COVID-19 vaccines to infertility that have been scientifically disproven. So women shouldn't worry whether they're trying to get pregnant, are pregnant, or are breastfeeding right now. The efficacy of the vaccine appears to be similar between pregnant and non-pregnant individuals. And then the safety for the newborn. They've found that for women that get the vaccine during the third trimester, they've found long-acting antibodies in the umbilical cord blood at birth. Those are the same antibodies that we hope that women will pass to their babies to help protect their babies from infection in the newborn period. So again, the people that make the rules for OBs in the country recommend that pregnant women be allowed to get the vaccine if they choose to. I think anything we do to try to keep pregnant women from getting COVID is important for helping them to be healthy and keep their babies healthy. And the vaccines appear to be just as safe and effective in pregnant women as non-pregnant women. If people want more information, I usually refer them to the ACOG website. It's acog.org. They have several statements on the COVID vaccine and safety in pregnancy. Thank you.
Thank you, Dr. Chadha. And please be sure and go to the website that Dr. Chadha referred you to, or ask your healthcare provider if you have questions or need other resources. I want to give you an update now on our clinics. Last week we had our first 2 neighborhood clinics at Air Park and Belmont Recreation Centers. As we've mentioned, we're increasing the number of smaller scale clinics in the community so that we can provide residents with additional options that help make vaccination more accessible, convenient, and close to home. This week, in partnership with the Black clergy of Lincoln, we're having another neighborhood clinic at City Impact, which will take place tomorrow from 3 to 7. We're also partnering with Cristo Rey Church and El Centro to host a clinic on Sunday, May 16th at Cristo Rey Church. And there will be a clinic at the F Street Community Center on Tuesday, May 18th. Looking ahead to the rest of this week, in addition to the clinic tomorrow at City Impact, there are clinics at Pinnacle Bank Arena on Friday and Saturday. Those clinics will include first and second doses. There are also second doses at the drive-through clinics at Gateway Mall on Wednesday and Saturday. Also this week, we're starting second doses for higher education and high school students, and we're once again providing those vaccinations on site at the local schools. Part of our plan to further expand vaccination opportunities includes offering COVID-19 vaccine at our health department, a place that is both familiar and convenient for many people in our community. We'll host clinics at the health department on Monday, May 17th and Friday, May 21st. If you haven't been vaccinated yet, we urge you to sign up at covid19.lincoln.ne.gov. There are lots of clinic options available for you. You can also find a local pharmacy offering vaccinations at vaccines.gov. And if you've had 1 dose of Pfizer and Moderna vaccine, remember you need 2 doses to get the most protection, so be sure to return for that second dose. This will also help Lancaster County reach our 75% vaccination goal. I also want to provide a quick update on Pfizer vaccine. Yesterday, the Food and Drug Administration authorized the vaccine for 12 to 15-year-olds. The next step is for the CDC Advisory Committee to conduct its review, which will happen tomorrow. The committee will decide whether to recommend the vaccine's use in 12 to 15-year-olds to CDC, and then CDC will need to sign off on the recommendation. As soon as we're notified of the final approval, we'll open appointments at upcoming clinics to this age group. Parents and guardians will be able to schedule online at covid19.lincoln.ne.gov. Those who are already in our registration system will be contacted to schedule an appointment. People who don't have an online access or need assistance can call us at 402-441-8006. Now let's take a look at our COVID-19 risk dial. We've continued to see an overall drop in cases over the past month or so. As I mentioned previously, the weekly case count dropped below 200 for the first time since last August. You can see the 7-day rolling average trending downward on this chart, down from around 50 on April 10th to 26 at the end of last week on May 8th. You can also clearly see on the right side of the chart the more significant drop just since May 1st. The 7-day rolling average of the number of patients in our local hospitals has hovered around 30 for several weeks. About 6 to 7% of our local hospitals' medical surge beds have been occupied by COVID-19 patients. This is putting us in the low yellow range. What that means is our hospital systems aren't highly stressed by the number of COVID-19 patients, and high-quality care can be provided to each patient. Now that we know more about COVID-19 vaccine and the impact it has had in the community, we've adjusted the vaccine metric used for the risk dial. The percentages were changed to 4 segments, so 75% is still the goal, and green for the vaccine metric is 75% or more. Yellow is 50% to 75%, orange is 25% to 50%, and the red represents 25% and below. This better reflects the risks associated with the percentage of people being fully vaccinated. You can see that the average turnaround time for contact tracing, our fatality rate, and our fatality rate are all in the green. The case rate, positivity rate, healthcare capacity, and vaccination rate are all now in yellow. With the positivity rates continued decline and the progress with vaccinations, all the metrics used for the COVID-19 risk dial are all green or yellow for the first time. This has resulted in the risk dial moving closer to the green category. However, this week the dial does remain in the low yellow category.
Thank you so much, Director Lopez, for your leadership, for everyone at the health team. Our community is making amazing progress, and thank you to all of you in our community who are getting vaccinated and taking common sense steps to help stop the spread of COVID-19. And to all of the community partners who are collaborating with our health team, thank you so much for your support. Support for our residents is coming from many directions right now. One of those supports is for businesses impacted economically by the pandemic. The federal government has put forward vital resources to help people and businesses impacted by the pandemic, and we want to shine light on one program in particular, given its time sensitivity and relevance to needs here on the ground in Lincoln. The Small Business Administration is awarding funding through the Restaurant Revitalization Program to restaurants, bars, and other similar places of business that serve food or drink. The purpose of this funding is to provide support to eligible entities that suffered revenue losses related to the pandemic. The SBA is accepting applications through an application portal that will remain open to any eligible establishment until all funds are exhausted. So resources available to applicants include a sample application, a program guide, and cross-program eligibility chart on SBA COVID-19 relief options. If you want more information about that, please visit sba.gov/restaurants. And for additional assistance, those in the restaurant industry can contact my office. They may speak with Kate Bowles, Mayoral Aide for Economic Development, at kbowles@lincoln.ne.gov. And as we at the city work to mitigate the impacts wrought by the pandemic, we continue to monitor and address issues that affect our own organization. Here with us today is Parks and Rec Director Lynn Johnson to discuss some city operations, how they may be affected this summer, and how you might be able to help. Welcome, Lynn.
Thank you, Mayor. Good afternoon. My name is Lynn Johnson. I'm the Director of the Parks and Recreation Department in Lincoln. We're very pleased to let you know that we plan to open all nine outdoor public pools in Lincoln this summer on Saturday, May 29th. However, we do have a bit of a challenge in that we're having some difficulty, like other organizations in our community and other communities across the state and really across the country, in hiring enough qualified pool staff this year. Typically this time of year, we'd be at about 85% of staffing levels. Right now, we're at about 65% of staffing levels. So we are planning some modifications to pool operations this summer and to programming as well. We are planning that there will be reduced evening hours this year due to the limited number of pool staff that we've been able to hire. Pool patrons, because of the COVID risk dial and because of directed health measures, will be asking that pool patrons provide their name and their phone number when they arrive at a pool. We'll be using that for contact tracing. We'll also be using the COVID risk dial and the local DHMs or directed health measures that are in place at the time to guide us about the capacity of pools. Swim lessons will again be offered this year, and registrations we anticipate will be somewhat limited due to limitations on the number of staff that we are able to hire. Pools will also again be available for private rental this summer during the evenings. And again, we think that the number of rentals will probably be limited due to staffing levels. We do encourage people who are interested in discussing rental of a pool to talk with the pool manager at the pool they'd like to rent after the pools are open. We want to let you know that the popular free water fitness classes will again be offered in the evening in pools. We'll actually be having water fitness at 5 pools this summer, including Woods Pool, which is a new location for us this year. Outdoor pools will close for the season on Sunday, August 15th. And we encourage you to please visit pools.lincoln.ne.gov for information about programs offered at Lincoln's Outdoor Pools this summer. We are continuing to seek applicants for pool staff, including lifeguards. Pool staff must be at least 16 years of age, and we'll be offering lifeguard training and certification for new employees if needed. If you're interested in seeking summer employment with the City of Lincoln, we encourage you to go to jobs.lincoln.ne.gov and go to the seasonal employment tab on that page. We're also continuing to look for park operations staff as well. As I say, we're very excited that we'll be opening pools this summer. It's great to have some things back to somewhat normal in Lincoln after the pandemic, and we look forward to seeing you at the pools. Mayor, thank you very much.
Thank you so much, Lynn. We really appreciate everything that you and your team at Parks and Recs do to provide wonderful opportunities for youth and adults in our community. And again, that website, if you're interested in the seasonal employment opportunity, is jobs.lincoln.ne.gov. And with that, we'd be happy to open up the briefing for any questions you may have for Director Lopez, Dr. Johnson, or Dr. Chada.
This is Brent with Channel 8. I have a question for Director Lopez.
She'll be right here.
Afternoon, Brent.
Hi, Director. Just a quick question. Seward last night joined Beatrice Public Schools in making masks optional in schools. You mentioned some of the improving metrics. Is that something you foresee happening with Lincoln Public Schools? And if so, when?
Brent, Lincoln Public Schools are, the last day of school is the 20th, which is next week. So we don't foresee any changes occurring before that time.
Appreciate it.
Mm-hmm.
Hi, Pat. It's Matt Olverding with the Journal-Star. I've got a couple questions for you.
Sure.
So speaking of mask mandates, you said this week that we're getting closer to the green. If the trends continue like they have been, it looks like we might hit the green maybe in a week or two. If the risk dial goes to the green, is the lifting of the mask mandate going to become a serious consideration for your department, for the city?
Matt, the mask mandate change is already a serious consideration for our department. We've always said that as soon as the community moves forward and meets those metrics, so we're looking at our vaccination numbers, we're looking at our positivity number and our case numbers. Once we get down to those 10 and below per 100,000, we've always said that we will change the mask mandate, and we have every intention of doing that.
Okay. And then in terms of vaccinations for kids 12 and up, if the CDC gives the green light tomorrow, are you guys planning on starting that right away this week, or would that be something that would likely come next week, or how do you see that working?
I really appreciate you asking that, Matt, because I ordered vaccine this week in case we did get the approval. So we're ready to have parents and guardians start scheduling appointments on Friday and Saturday at the Pinnacle Bank Arena. Should CDC pass that, we'll get the word out immediately, and we're going to ask all of you to help us get that message out in the community so parents can reach out and get their child scheduled.
Great, thank you.
Mm-hmm.
Director Lopez, this is Bill with 1011. You had mentioned the mask mandate being already a serious consideration. I believe the DHM expires May 21st. I mean, is it feasible that mandate could expire on May 21st?
Bill, if I had a crystal ball, I could probably tell you that for sure. But I do know, we're watching every day about what's happening. We're consulting with our team that we've worked with all along throughout the pandemic. But I think, anything is possible. what we really want to do is get that message out. You know, it has made such a tremendous difference in our community that so many people are getting fully vaccinated. And I am so grateful, but I want people to know that it really is making the difference. Our community still is #1 in the state, actually, for people that are fully vaccinated. And we're still #1 in the state for people getting their first dose. And you can see by the charts we showed you today very clearly the difference that it's making.
Do you know offhand how many Pfizer vaccinations you have this week to potentially give out?
I think you could, and I'm saying I think, I want you to remember that. I think we probably have over 10,000 that we can give this week, because I ordered 8,100 in addition to what we had on hand.
So a parent that's watching this of a 12 to 15-year-old, if they want their child vaccinated this week and they sign up, they absolutely can probably do that then.
Right, absolutely. I wanted it to be that way. And we potentially have, depending on what census numbers you look at, between 13,000 and 16,000 youth in that age range that we could vaccinate.
Are there any further questions?
Hi, Mayor. This is Matt Olbering again. I have a question for Parks Director Johnson.
Yep, I'll be right here.
Thank you.
Good afternoon, Matt.
Hi, Lynn. You mentioned that because of staffing issues, the pools will have limited evening hours. Have you guys made the decision as what those hours are yet, or are you still working on that?
We've actually identified the hours. Essentially, it's going to be a reduction of 1 hour, I think, at each one of the pools. We've got a news release that's going to be distributed right after the news conference that will have the hours of operation for all 9 of the pools.
Okay, great. Thank you.
Matt, thank you.
Director, before you go, this is Brent with Channel 8. You mentioned you're about 20% below your normal staffing level at this point. Do you know about how many jobs you do have available still?
I think the number of pool staff, I have Kayla Selhorn, who is our aquatics coordinator, with us this afternoon, and I think we're still looking for about 30 staff members, if I remember right.
And that's across all pools?
It is all pools, yeah. Really, the biggest challenge we've had this year is at the larger pools, because we operated the smaller neighborhood pools last summer. About 60 to 70% of our staff returned from one year to the next. So it was actually easier for our pool managers to find staff for the smaller neighborhood pools, because those pools have been operated last year. And we've had to work a little bit harder to get the larger pools staffed. My understanding is that Star City Shores is fully staffed at this point, and that's the largest pool that we operate, obviously.
Gotcha. Thank you.
You bet. Thank you.
Any last questions before we close? Okay, well, if not, I just wanted to say thanks again to Dr. Sarah Chada for being here with us today to share her important messages, and to everyone who has rolled up their sleeves to protect themselves and our wider community. Thank you so much for making Lincoln's remarkable progress possible.